it's CJ. I know that this is not a terribly popular opinion, but the NIPT, the non-invasive prenatal testing, is not just about your gender reveal. The actual purpose of this test is to see if your baby is at increased risk for chromosomal abnormalities. So today, I want to take the time to tell you 5 things that I really like about non-invasive testing. I'll let you know 5 things that you might not be aware of regarding testing, and if you stick around, I'll let you know what you can expect if your testing comes back anything other than normal. Here are the 5 things that I really like about non-invasive testing. Number 1, it is perfectly safe for you and your baby. It is a simple blood draw. Number 2, you can get tested anytime after 10 weeks gestation. Number 3, the test can help screen for genetic abnormalities such as Down syndrome and trisomy 18. Number 4, it can help predict the gender of your baby. And number 5, in the United States, testing is actually recommended for all pregnant women, regardless of their risk factors. That being said, here are the 5 things that you might not be aware of regarding non-invasive testing. Number 1, it is a screening test only. It does not provide a diagnosis. Number 2, although it tests for some chromosomal abnormalities, it doesn't test for all of them. Number 3, if you have an autoimmune disorder, if your BMI is greater than 30, if you get testing done prior to 10 weeks, there's a chance that your test can come back inconclusive because you just don't have enough fetal cells in your circulation just yet. Number 4, there are a number of different tests available on the market. Some of them are 99.9% accurate, some only 95%, which can lead to false positive results, increased anxiety, or false negatives with misdiagnoses. Also, if you're counting on that for your gender reveal, it might not always be correct. I usually tell my patients, even after you get your results back, wait until you have your ultrasound before spreading the good news. And number 5, although the testing is recommended for all pregnant women, not all insurance companies will cover it. Some will only let you have it if you are considered high risk. High risk is if you're 35 years of age or older, if you have a previous child with a chromosomal abnormality, if you have an abnormal finding on your ultrasound. Also, the test is not readily available to all pregnant women, and if it's not covered by your insurance, it can be cost prohibitive. Finally, here's what you can expect if your results don't come back normal. If your result is inconclusive, if the fetal fraction is less than 4%, most likely you just don't have enough fetal DNA in your circulation yet, and you can repeat testing in 2 to 3 weeks. If your result comes back and indicates an increased risk for a genetic abnormality, your provider might order what's called a level 2 ultrasound. That's an ultrasound that's done by a high-risk specialist. They're going to take a very close look at your baby's heart. Or they may even recommend amniocentesis. That is a procedure that's done where they put a needle into your uterus, withdraw amniotic fluid, and do chromosomal studies on it. The amniocentesis is the only true way to get a definitive diagnosis. I do hope that this information has been helpful for you, and that if you have any questions, you'll leave those for me in the comment section below. And while you're in that comment section, I always appreciate it when you hit the like button, or even better, feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.